This is Radio Islam International, and it's our great pleasure to bring you this evening an eyewitness account from a doctor who recently returned from a medical mission to the occupied Gaza Strip. He is the consultant vascular surgeon who works for National Health Care Service in the United Kingdom, humanitarian and disaster relief worker who went to Gaza in April for 15 days with Fajr Scientific as well as the World Health Organization. Our great pleasure to welcome Dr. Junaid Sultan to the airwaves this evening. Doctor, thank you so much for your time, and assalamu alaikum.
Wa alaikum salam, and thank you so much for having me, and really appreciate for giving me your forum.
Doctor, just give us a bit of a background on a few things before we dive into your all-important experience. And it's so important to hear your voice because I think there are many medical personnel in Gaza. A lot of their messages do come out periodically through social media, but the full picture certainly is much more complex and much more painful than those small tidbits that we see in our social media profiles. And you certainly have been there for a long period to convey your own experiences and perhaps some of what they would like to share with the world as well. Firstly, a bit about yourself. You describe yourself as a vascular surgeon working in the United Kingdom. So just break that down for us exactly what's the main work in the medical sector that you do.
Being a vascular surgeon, I mainly deal with all the blood vessels all over the body, and my role is to basically ensure that wherever in the body there is any evidence of any ischemia, and I try to help it, and that involves treating with the arteries and veins, and it involves doing the bypasses, treating complex diseases like aneurysm, stroke, diabetes, and patients with renal disease, and help them to make fistula for them so that they can have successful dialysis. Also, then I have being a vascular surgeon, help with the trauma management, where patients come with the life or limb-threatening injuries, and where we have to do repair of the blood vessels to save those as well. So it is a quite broad spectrum specialty, which kind of pretty much works with most of the other specialties where they need input and help from the vascular surgeon. So we work in close collaboration with many other specialties in the hospitals.
In terms of the mission that you then embarked on in April, and it's significant that it happened in April because there are perhaps major developments that occurred after that that just made the situation even worse. But in April, you went with, as we mentioned, the World Health Organization and Fajr Scientific. Give us a background to the team that went through the objectives of the mission and exactly a bit more about the Fajr Scientific for that matter.
So this was the first mission with Fajr Scientific, and they were very challenging times. As you know that when we entered on the 3rd of April, so the situation itself was very challenging because the World Kitchen team was, their team was murdered on the 2nd of April. So the situation was in a very difficult time at that time, and things were evolving at a very rapid pace. And there was a lot of debate which was going on regarding the Rafah invasion. And if you remember at that time during our stay, there was a lot of heated kind of a conversation between Iran and Israel, and there was an attack, and then that created and escalated the situation to another level. So there was a lot happening during that mission, and due to that, there was a imminent attack expected on the European hospital even during our time while our mission was based at the European hospital. So I will start with the fact that for us, being part of the Fajr team, it was a very first mission for us. So, and part of the Fajr, we have to go and we have to establish our kind of ground contact, establish links with the local team, and establish that rapport with the local healthcare workers and start the humanitarian work. So, and on top of that, the situation was so tense when every day you never know, it was very unpredictable what could happen. And we were getting a lot of restrictions, even being the humanitarian work that kind of, you have to do this and that, instructions by the IDF. So these were all very challenging and difficult times. But even with all those constraints, we managed to deliver as best as we could. and we work in collaboration with the local doctors, and we took a lot of medical supplies with us, and we helped them as much as we can and facilitated the healthcare facilities in Gaza in the best possible way what we could have. We managed to keep the operation theaters running. We managed to get the medications. We managed to get the supplies, in particularly the orthopedic medical supplies in terms of the implants. With the If there are any medical community listening to this, like the gamma nails and artificial hips and stuff, so help with the trauma management and things. Also, we managed to take equipment like the instruments to facilitate the surgeries in vascular surgery, urology, and other important surgical specialties. So there are many goals which we achieved with this first mission, and which I feel like really proud of being part of the Fajr team in that, where we achieved a lot together.
The experience in Gaza, was it a unique one? Obviously, the circumstances are totally mind-blowing, what is occurring in Gaza right now. But have you had any prior experience in combat zones around the world that you'd be able to compare this current experience to?
I have experienced more with the disaster relief work areas, and I cannot compare directly with the another war zone area. But we had other humanitarians in our mission who have been to the other war zone missions, including Ukraine, Yemen, and Syria. Um, and when we kind of compare our experiences together, and what we were able to basically conclude, that Gaza is a completely unique situation compared to any other conflict in the world, any other war or any other sort of a conflict you can compare to. And the biggest situation for and the biggest reason for that was that in any other conflict, if you see the United Nation or the other kind of humanitarians, they have some sort of an access kind of so they are able to get and link to the outside world. This Gaza is so unique in the situation that it's completely besieged by the IDF and occupation forces, that land, air, sea, you name it, and there is no way. Once you are inside Gaza, you are completely kind of cut off, and you are only at the mercy of the IDF and occupation forces. So you cannot make any connection or any link with the outside, and even United Nations are completely dependent on them. And without the say of the IDF, nothing can go in or out of the Gaza. So that has a huge impact on the humanitarian work and on the humanitarians itself. And you have seen how many humanitarians being killed, how many workers of the United Nations have been killed in this whole conflict. And this is very different and unique to this alone. And nothing like this has happened in any other conflict zone ever before. And due to that, they have such a control that, only the humanitarians with certain ethnicities, with certain nationalities, they can only go in and out of the Gaza. So this is another something which is against the international humanitarian laws, where the humanitarians are being scrutinized for their nationality, that why kind of, only certain nationalities can go in, and why not every humanitarian who wants to go and work in Gaza, they can have access to go and work there. Similarly, the cap on the medical supplies, then humanitarians can take only certain supplies and certain kind of, number of those medical supplies with them. This is another cap which is not seen in any other conflict zone as well. And if something situation happens where help is needed, then United Nations is even they struggle to help kind of, any humanitarian on the ground, and they have to go some certain very strict and robust sort of a process to engage with the IDF forces to get those humanitarians out and do this evacuation process. So there are lots and lots of constraints through which the humanitarians have to work in this unique situation. And when you compare the other things, which is the environment as well itself. So when you enter Gaza, so like there is a constant noise 24/7 of the drones, and the drones are hovering on top of you, and humanitarians are being constantly monitored. And this is, you don't see any other conflict zone. You are, constantly kind of, the safe zone, which is supposed to be where you are staying. And this is in agreement with the IDF, United Nations, and all the involved parties. And then that can be very easily bombed. You have seen the organization, from UK, MAP, Medical Aid for Palestine. So their house was being bombed, and all the humanitarians inside, they had a lucky escape, and they were saved, and they didn't die in that. And likewise, in our safe house, so we had bombs which fell literally a couple of streets away from us, and our whole house was shaked. So the hospitals where we are working, kind of, so the bombs are falling next to it, and the whole hospital literally shakes. And then we have seen pretty much all the hospitals have been attacked in Gaza by this time now. So in none of the other conflicts, the hospitals have been targeted, the healthcare workers have been targeted. So this is something very unique and very worrying. And this is, I think, a very important message that the whole world needs to know, that why this is so unique.
Doctor, you did mention all the difficulties, and we know when it comes to humanitarian aid, particularly since the takeover of Rafah, the Rafah terminal, this has just exacerbated the logistical problems relating to the delivery of food. Now, I'm in a sense gratified to some degree to hear that you did manage to get certain vital medical supplies in, obviously very far from what is sufficient, but you did manage, as you described, to get some of these medical supplies in. At this point in time, after your mission, do you have an idea in terms of medical supplies entering the Gaza Strip? Has that ground to a complete halt, or are humanitarian teams, medical teams, the like of the one that you took part in, similar teams, still able to do something in this regard?
So the situation is actually changing every day and getting worse by worse. So during our mission, when we were there during the April time, so the Rafah border was still opening, because by the time we came out, and actually the next day, the Rafah border pretty much kind of closed. So even when we went in, we were allowed kind of, like as a humanitarian. So you have to understand that there are like the normal supplies which go through the crossing, which are part of the United Nations and other organization take, and then what you can take with the humanitarian missions. So that is two separate things. So the journal kind of, supply, if I just first of all comment on that. So before this war started, there were 500 trucks which were supposed to be entering every day in Rafah via Rafah crossing. Yeah. So after the war started, since 7th of October, that number dropped to something like between 60 to 100 per day. So actually, because of the destruction of the war, that number should have increased to 1,500 to 2,000 per day, because there was a huge difference in between demand and supply. But that was reduced to 600. Medical missions were allowed to take some supplies with them. And when our mission went in, we were allowed to take 5 bags per doctor. And out of those 5 bags, usually 2 to 3 bags each doctor was taking for their own personal supplies, which included, your own personal food and water, so that, you are sufficiently self-equipped for the 2 to 3 weeks when you are there as part of the medical mission. And then as per each specialty, each physician was taking kind of 3 bags of other medical supplies, whatever, like sutures, equipment, specialists, what we could. So we still managed to take some. But when we went inside, we noted that there was such a huge need. We thought we took a lot with us, but that literally finished by literally kind of, within less than 2 weeks. By the time our mission was kind of, going out, so we had almost run out of a lot of the things. And that was the reason, because there was such a huge demand of the supplies. But once our mission came out and Rafah border closed, then the situation went absolutely like, to the extreme worst possible scenario, because those 60 to 100 truck supplies which were going in per day, that has reduced to something like only 5 to 10 per day. So which is a significant. So you can imagine like a whole Gaza Strip with a population of kind of 2.2 million population only running on 5 to 10 trucks per day, which is like a joke. That how can anybody in the world can justify that this will be enough to sustain a population of that much size. And then the rules became so strict on the medical missions that those 5 bags are reduced to 1 bag per humanitarian. In that 1 bag, how can you even imagine a humanitarian cannot even take even a sufficient food for themselves? How can they take even any medical supply with us? So this is extremely bad situation right now. So you are hardly able to take much supplies in. You, even as a humanitarian, go in, you are struggling with the basic medications, including anesthetic, antibiotics, painkillers, to even kind of, sustain the normal kind of, day-to-day routine kind of, operations and other things like that. So that's why the even when I was there with my eyes, I witnessed kind of, the situation of the famine, starvation, and hunger. And right now, that has escalated to 10 times worse. And our mission, which is based right now there, and what they report is things are 10 times worse than when we were in Rafah in April.
So, are there still medical teams that are able to enter at this moment?
Yes, so the number of medical teams have been reduced significantly. For example, when our mission went in, we were allowed 15 people in that mission. But now the current Fajr mission is reduced to only 3 people. So, and among the 3 people, then they were allowed to take only one bag per doctor. So, which you can imagine, the teams are there, but they have severely constrained facilities within which they can operate, basically.
Now, Doctor, as far as the role of teams like yourself, if you could give us an idea, what is the level? Obviously, we know the facilities have been stripped down to very basic facilities. Lots of improvisation that's taking place in hospitals, and very few functioning hospitals. In terms of the medical personnel in Gaza, how would you define their level of expertise to deal with the kind of conditions that are before them? And then the missions like yourself, what role would you be playing? Are you providing just additional assistance, or are you providing a whole level of different expertise that is non-existent in Gaza?
So I have to be very kind of clear on this subject, because the local doctors are actually very well trained and very good, because they've been kind of dealing with this sort of a situation and trauma for a long time. So they know very well how to deal with the trauma and what to kind of handle with it, and even the workload. So, and this is quite like surprising that the amount of the workload they get, like 50 to 100 patients coming in at one single time after a bombing or kind of extensive firing, and a sudden, and then how kind of calmly they try to manage and deal with that situation. And their operating skills are really good. I have no doubt in their abilities. So what we do when we go as a medical efficient kind of so these doctors and nurses, they've been working kind of a pretty much 24/7 for the last 9 months. They are exhausted. They are also kind of they have seen their loved ones brought to them as dead. They have seen their loved ones brought to them as injured. 550 of their colleagues have been killed. They are emotionally and mentally quite going through a significant trauma right now. Even they don't let it look like or appear like, they always appear very calm and very kind of calm and collected, and they are performing their duty in the best possible way what you could think of. So I have very high, I regard them very highly, and I have a lot of respect for all of them. But what we do is that we give them in the sense kind of a relief, because we can be there and we can take over their role, in the sense they can get a little bit of a break, because we can operate, and it gives them a bit of a rest time, and they can take a bit of a break. We additional kind of if like based on our experience in the more modern world in the West, the new skills and new anything which we have, we can go and share those ideas with them, and then we contribute to their existing knowledge, and we kind of share those. So it is a good team working and collaboration, basically, essentially, by which both their existing system and our we can. But the biggest problem right now is that they are essentially being pushed towards, like, literally in the medieval time ages, because lack of the antibiotics, lack of the other equipment, lack of the other kind of so even the best of the best doctor will struggle in that sort of environment, because if you do not have any tools, how can you kind of perform with them? And that is their main struggle right now. And the complication rate is 100%. Every wound is pretty much getting infected, and lack of food is making the patients kind of really emaciated, and they have no immunity, and everyone is getting infection and stuff. So you have to consider all these factors into it, and what the challenges of the doctors are, and what making the whole situation so challenging and difficult for them, basically. And they've been working without any salary in a voluntary capacity as well. And so these are the few things which I really want to praise and appreciate what their challenges are there.
Doctor, let's, as we wind up this interview, and there's so much more to share, but I wanted to ask you, in the event that, as we're all hoping for a ceasefire anytime soon, and hopefully a permanent cessation of these kind of crimes, uh, is the world still going to be utterly shocked by the day after picture that emerges in Gaza? You know, everybody thinks that we understand the scale of the atrocities taking place in Gaza, but from what you saw of burn wounds, shrapnel wounds, amputations or potential amputations, potential complications going forward, are we kind of going to see, if I want to, use it in a loose sense, but dead men walking, the moment the clouds of war potentially stop in the Gaza Strip?
Um, I have described the whole situation literally as Armageddon, and it is so bad. The mainstream media is not showing anything at all. And what you see on the social media is literally like probably 25% of it, what is actually on the ground and what we have seen with our eyes and how bad the situation is. When this war stops, and right now, if you see, one of the reason why humanitarians are getting so much tough time by IDF forces is because we are the only point of contact between Gaza and the outside world. And we are the only one, we bring any information out, we share, and we share it with the people and public, and we make them aware of the severity of the situation. We are the basically kind of acting as the journalists, and we are collaborating and we are showing all that. And that's why we as humanitarians are getting such a bad hit by the IDF forces. When this situation eases and the mainstream media goes in, and when that will be shown to the public, it will be a shock. You will see how much the extent of the devastation is in there. Um, the life for them has been made unlivable. The Gaza has been made like a living hell for these people. And the situation is beyond understanding how bad it is. Um, they've been made to live like literally worse than animals in there. And how the circumstances, the situation in which they are working, the basic things like, like the access to the water, food, sanitation, use of the toilet, things like that, none of it essentially kind of exists anymore. People have not had shower for weeks to months. I have seen patients with maggots in their wounds and with fleas in their blankets, which they were covering with because they had nowhere to go and wash or do anything with it. So things which you will see the complications and things which you have heard only in the books before and things from the medieval times. And I have witnessed all that in those. Um, it's the war crimes which have happened there are undescribable, and that's why it's very, very important that the mainstream media need to go there and they need to show it all so that the world knows what is going on there and what the ground reality is. And not only the media but the representative from the developing world who from the developed world who talk a lot about it and who are directly being contributing to this, they need to go there and they need to witness this with their eyes that what their decisions are doing, and they need to witness that with their own eyes.
A second, a penultimate question for you, Doctor, would be the how do you still maintain a sense of decorum? How do you, I guess, suppress your natural human emotions, whether it's grief, whether it's pain, whether it's anger, when you talk about this? And I'm sure, pretty sure that you yourself had faced situations where you know that a limb could be saved under normal circumstances, or that a life can be saved under normal circumstances, but you somehow have to let the case go, watch a person die, watch a limb go, even though that's perfectly avoidable in normal circumstances. How do you maintain a sense of decorum, knowing all of these things and having experienced all of this?
um, Getting close to my faith and prayers, I find a lot of peace in that. And I got alhamdulillah, good family and friends, and I chat a lot with them and discuss and went out. And secondly, I've become, and third, the most important thing is I've become the voice of Palestinians. And I try to kind of, raise this awareness on every forum where I can, and I share it openly, and I share it with people what the ground reality is, and I share what the increase the awareness about this whole matter. And I do it in my local community, I do it nationally, internationally, wherever I can, and I have become their voice. And when I share this and people know, and that really helps me, and at least I feel like that this is one way I'm helping them, and that has been a whole source of relief for me.
And Doctor, I want to ask you a special message for the medical community. I've heard you speak previously about medical students in Gaza, and you've also touched on this evening the absolute heroism and self-sacrifice of medical personnel, trained medical personnel in the Gaza Strip. For medical personnel themselves, people in the medical field, medical NGOs, what exactly can they do from their side to assist those most in need in Gaza?
The most I would like to highlight in the form of the points, the most and important point is the please don't stop advocacy. Continue as powerful advocacy as possible and increase this awareness and be the voice for Palestinians. And they are going through the most worst atrocities of the lifetime in the history of the world. And the world needs to know that. So be their advocate and raise this advocacy on the political and medical on all levels, and force to help to open the humanitarian corridor. This humanitarian corridor is their lifeline. This humanitarian corridor needs to be open for the basic medical facilities, fuel for the hospitals to continue to operate generators, and food and water. So this is absolutely essential, and fight for that. And make sure you go to your MPs, your political leaders, and the medical bodies and do what you can to help with that. And third, the most important, being part of this medical profession, what you can do is you speak to your institutes like royal colleges and other medical bodies, and you ask them that what are they doing, because being part of the medical community, we took an oath and we are supposed to be adopting the principle of medical neutrality, but that means that we need to be impartial. So we do not need to be silent. So there is a huge difference between silence and medical neutrality and speaking with impartiality. So they need to share the ground facts, and what is right and what is wrong. But do not be silent, because being silent, you are actually being part of the suppressor. So they need to help to differentiate and able to understand these concepts. And what also they can do is they can really, really help the medical student and junior doctors from Gaza, because the junior doctors who have very limited hospitals kind of left the placements to finish their trainings, and they are really struggling. And if we can give them international fellowships and bring them to our hospitals, let them finish their training and then send them back, and they could become the vital part of the healthcare infrastructure in Gaza and can go and help to serve. The medical students are particularly suffering a lot because their medical schools been completely destroyed, and because of lack of internet, lack of electricity, it is difficult for them to continue any sort of medical education in the best possible way. And because of lack of their homes and they are living in tents, it's very difficult for them to continue their medical education in these sort of circumstances. So if we can give them special scholarships and they can come and continue in the same year in which their education has been stopped right now, and they can complete their medical school and go back and be part of the healthcare infrastructure in Gaza. So these are the few ways by which being a medic, or you can contribute, you can help. So there are many ways. Don't feel like helpless. Every little helps, every little contributes. So please keep doing anything what you can in your capacity among any of these things. Get in touch with us, get in touch with Fajr. We have many more initiatives going on. Be part of us. Let's work together, join and contribute what we can in every possible way what we can.
Lastly, Doctor, anything, besides the realistic, very bleak picture, which you conveyed to us, perhaps just the tip of the iceberg, given the time that we had and the questions that we posed, but anything that you saw that, in spite of everything else, still gave you inspiration, gave you hope in these very bleak circumstances?
What gave me hope is the resilience and the endurance of the Palestinians. And being part of the Fajr, we do a lot of other initiatives, and we took food and we tried to distribute to the people in tents. And when we went there and we distributed food among the Palestinians, and some of them, they didn't even had food like for a week or so. But the first thing, when we went and we gave them the food is, and they asked us that, has the person next to us, have they had food? Have they been fed? So this is how kind of, good these people are. And this is kind of, their resilience is, and how they look after each other and how they work as a team. So this was a very huge sign of hope, that these are the people who, even in those difficult circumstances, they stand with each other, and they will go through everything, but they will not lose faith and hope. So this was a huge source of inspiration for me, and I learned a lot from them, basically.
Do you expect or do you hope to go to Gaza again anytime soon, Doctor?
Yes, I am, and I'm hoping to plan my next mission in October. I'm working on the few different projects. Particularly, I'm working with the locals and Fajr team together, and my target is to particularly work for the wound care project, rehabilitation project, and the infection control project. So these are the three my main fundamental objectives, and I'm working on some projects with Fajr, and we are trying to raise awareness, and with the help of locals, we will target those, because it's very important that we get sufficient supplies and sufficient equipment to ensure that the infection gets controlled, which will further help in the healing of the wound, and which will further help in controlling of the infection and other complications. We right now have a whole army of amputees in Gaza, especially the kids. And me being a vascular surgeon, I deal with the amputees every day, but it's soul breaking when I see like children of 1 to 2 years age with their limbs amputated. How do you even, like, it's such a challenge to help them to rehabilitate and go through this, and with their artificial limbs and other things. So what my plea to the people is that if you are watching this and if you're listening to this, help me, and into particularly with the rehabilitation goals and how we can help these amputee kids and adults kind of, and help them through this rehabilitation process. So we will try to achieve this. So please do whatever you can and help me with establishing and completing those projects so we can help the locals there, please.
Indeed, I'd like to thank you so much for speaking to us this evening. And as you've mentioned, you visited Gaza, and there's obviously appeals projects ongoing with the team that you participated in, the Fajr Scientific team. People can connect with them on social media at Fajr Scientific, or visit the website to find out more about the medical mission, particularly those in the medical field or anybody who would like to assist. The website is fajr.org. Dr. Junaid Sultan, it's been a great pleasure speaking to you. Probably very somber content, a very somber setting to have this discussion, but a very important discussion to have nonetheless. Thank you so much for sharing this information with our listenership, and may Allah subhanahu wa ta'ala be with you in all the great work that you continue to espouse for humanity in the United Kingdom as well as in Gaza, other parts of the world. Thank you so much, and assalamu alaikum wa rahmatullah.
Thank you so much. Thank you. Bye-bye.
And that was the consultant vascular surgeon, Dr. Junaid Sultan, also known popularly as Dr. Juni, works for the National Healthcare Service in the United Kingdom, humanitarian and disaster relief worker. Been to Gaza in April, as he's described to us, with a team from Fajr Scientific and the World Health Organization. Fajr.org. You can check out the website if you'd like more information on the mission. Till we meet again, it's been great being in your company. Assalamu alaikum wa rahmatullahi wa barakatuh.